It's your boy Young Love, I give him that time. Pancho leg stand and punchy America. Banji dual, the Banaban. Pancho leg stand and punchy America. Banji dual, the Banaban. Walk on your leg, Kankaro, what I know watching. Oga level leg, gear, wow, very leg. Panda with ya, punchy America. Panya dual, Bano, Chingatongo, Pandon, could you ever buy a check out? Papu Panda, gear, what ya be dual venting. Stand and punchy America, Banji dual, Banaban, Pancha leg stand and punchy America, Banji dual, Banaban, walk on your leg, Kankaro, what I know watching, Oga level leg, gear, wow, very leg, Panda with ya, punchy America, Panya dual, Bano, Chingatongo, Pandon, could you ever buy a check out, Paku Panda, gear, what ya be, dual, venting.
Yes, good morning, good afternoon, good evening. I welcome our audience to Lake State Media, and also welcome our guest today. But I will give chance our General Secretary Majong Makur Malang Parech, the General Secretary of Lake State Media, to welcome and introduce our guest to our audience. And then we will start our topic of today. Thank you.
Thank you so much, Deputy Chair Bolmakur. To all our viewers across the globe, you're all welcome to Lake State Media. Today's show on 16th of June 2022. And in the studio with us, we have leaders, the chairperson and the deputy chair of Barakazal Nursing and Midwifery Student Association of the Universities and Higher Learning Institutes. And today they will talk to us about many things. And we are all aware about the early status of our country and especially the people of the rural areas, especially the states. And they have made a significant report. They conducted a survey based on the health facilities of the entire Barakazal region. And that is why they came out today to let the public know what they have and also to introduce themselves to the public. Before I yield it back to them, I have this privilege to mention the names before I give it back to them so that they can give the opening remark. The chairperson of Barakazal Nursing and Midwifery Student Association is Mr. Malwal Ajuat Bungreal, deputized by Mr. Wal Momo. And then one of the guests is missing, but he will join us shortly, Mr. Joseph Maya Madut, the Secretary for Health. So these are the guests of today, and we will explore more and we will listen to them more. All our viewers, you are highly welcome at Lake State Media. Mr. Wool and Mr. Malwal, you're welcome to Lake State Media Beyond Boundaries. So I'll give it to Deputy Chair, Wal Momo, to give his opening remark. And then after you, Chairman Malwal will come in with his opening remark, or you will welcome your chairman. You can take your floor, Wal.
Yeah. Thank you, Lagos State Media. Today, it is a great privilege. I count it a privilege to have been hosted by the Lagos State Media. We are very glad for all that you have done. You are a very special media to all of us, because without you, some of our people might not know what is happening in Banamsa. My name is Wolmonmo. I am the Deputy President of the Banamsa. The Banamsa is abbreviation for Barhazal Nursing and Midwifery Association for the students of Barhazal region. So today, to all our listeners, yesterday we promised you to come live on this media exactly at 7. But somehow there is little delayment that happened because of network and some other issues around. So we should forgive us for that. And we are very happy that you have been patient with us, no matter what was happening. Barhazal Nursing and Midwifery Association actually will be explained to you very well by my chairman, what it is, what are our role, what are the objectives. He will tell you more about them. But I have been given the topic today to discuss or to let you know about what I am here to present. So on the remark, yeah, my top, what I will talk about the nursing and midwives in Barhazal, a statistic of midwives and nurses across Barhazal region is what I am going to tell you today, and what are the challenges and how best we have formed this association to tackle or to solve their problems. So here I will give floor, I will welcome you, my chairman, come and introduce himself. Yeah, he's a great man. So I think you will hear him how he speak, and you will like it. So, Mr. Chairman, you are welcome. Thank you.
Thank you very much, my brother, Comrade Wolmo, who is the Deputy Chair of Banamsa. And I also would like to congratulate the members of Lake State Media, in particular, the President Isaac, Deputy Bol Makur, and the Secretary General Majok as well. So it is my privilege today to be host, or for Banamsa to be host by Lake State Media. And I would like to appreciate Lake State Media for providing comprehensive information in either in politics, in education, in health, and other sectors as well to the people of South Sudan. So, as you know very well, that media is a very important instrument for any development of the nation, because you cannot be aware without the media. So, media is very important in providing information to the people that are part of or that are not in the center of any discussion. So I would like to thank them very much for their continued support in providing information, and in particular of hosting Banamsa in this today. Thank you very much.
You're welcome.
Thank you. The President of Banamsa and the Deputy President, you're welcome once again, and your appreciation is highly welcome and acknowledged. To all our viewers, it is our mandate as the media platform to host the people of the country to give us information. A citizen with the information is the one that is in the right positions to make rightful decisions at the right time. So today we will hear a lot of health issues. I remember These gentlemen, they came at the right time. It was last week when the Ministry of Health published over 3,000 or 30-something thousand South Sudanese pound that has been affected by HIV and AIDS. So it is the right time for them to speak to us and also to warn the public against such sexual transmitted diseases. So, Deputy Chair, you will take your time to make your presentation, Mr. Wolmomo. And then after you are done with your presentation, we'll go to your chairman also to make his presentation. And then after you are done with your presentation, we will embark on the question section. And basically to our viewers, bear with us. We might not take long. It will be at least 1 hour interview. Thank you, Brother Wol Momo. You can take the floor.
Thank you. You can raise the voice, the volume.
We are not hearing you, Bol.
Yes.
I always put mic on, so I cannot be here on. My kids are here in close to me, and I don't want them to interrupt the show. Sorry about that. Mr. Wol Momo, the reason why we host you, we are very concerned about the health of the people in our country, because we know health is important to live life to the fullest. When a person leads a healthy lifestyle, the body remains healthy and the mind is active and fresh. So if we live healthy life, our people, body and their mind will be fresh and actively doing their duties in the country. And especially there is a more concern about our women delivery system, because there are so many challenges that facing Junubin women, and it is very hard for people who live very far from the towns to access the ambulance to bring our women to nearby hospitals to deliver. So these are the challenges that are facing people in our country, and it is good that you guys have established this institution to train our women, and for our people around the world to know what people are doing. That's why we bring you to the media, so you guys also can be supported. There is a good Samaritan who like this program, might support. And also the government might even not aware in Juba that the nursing facility is being established in Bahr el Ghazal. And once they pick it up from Lake State Media, they will learn more and they might support the program. That's why we host you today, so people of Junub Sudan can learn what nursing school is doing in Bahr el Ghazal. I will give you a floor to continue. Tell us why were you with your team? What energized you to establish this institution? Thank you.
Thank you. I am very happy once again to be given that to be given the chance to speak out on this issue. You know, here I'm talking, focusing on Bahr Ghazal, and we will also talk about, we will talk little on Upper Nile, because both Bahr Ghazal and Upper Nile, they are affected. They have the same challenge. So what I'm going to say here, health system is as a result of insufficient trained nursing personnel and midwiferys. Either it is affected positively or it is affected negatively. So nursing, the absence or the presence of nursing has an impact both on the country and in the region or in the village. Reason why we have come up with this association and to why I have been given the topic to present is because there in Barkhazal, there are a lot of challenges. There are no nurses, there are no midwives. We have, but here in our, what we consider to be nothing is when something is not accommodating the group of people. The nurses that we have, of course, we have nurses, but they are not enough compared to the population we have in our region. So the nurses and midwives in those areas, they are very few. And we have to address these challenges because when the nurses and midwives are not enough, it will affect the pregnant mothers, the old, the young children, even the unborn children also, pregnant mothers also, they are all affected. If we have nurses, the midwife will take care of pregnant mother, so that there will be nothing, no reports of miscarriages in the area. So let me come back to this one like this. What I'm trying to say is that nurses in our region, they are not many. And the reason why there are not many is because there are no institutions that are made specifically for this field. They need education, yes. They need to go to nursing school, to midwifery schools, and be trained to become professionals. But there are no institutions, there is no conducive environment that will encourage them to pursue their heart desires. So here, that is why we want this. We are raising our voice. This is their voice that we are presenting. Yeah, to let the public know that the reason why there are no nurses, the reason why there are no midwives in the region is because there are no institutions that have been established. If the government could at least establish each year at least one institution or 10 institutions in every state, this thing will have a great impact. Or at least after every 2 years, they build institution and dedicate it, then give it to the community and let the NGOs come in and fund the project or fund the institution. I think it can be well. People will come, they will roll in, and then they will study. After 3 years, they will go back and serve the communities. But since there are no institutions and the government is not taking care of this, that is why our people are perishing. Do you understand? So these are the challenges. These are the challenges. Midwives, you will see a lot of unborn children. Premature. There are a lot of children that are born premature. Why? Because there was no enough follow-up with their doctors or midwives. If the woman, for example, is pregnant and she has the nearest health facility, she will be going there and follow up until after 9 months she will have a safe delivery. But down there in the village, there are no things like that. You will see a pregnant mother carrying the belly until it reaches this stage. After 9 months, they will say no, or she will deliver safely. She will deliver safely, but she will be having anemia whatsoever. All those things is because if we have nurses, they could not happen. Yeah, people actually down there, they are living by the grace of God. Yeah, so that is, yeah.
Thank you all for briefing.
Yeah, that is.
We know that midwife is a healthy professional trained to support and care for women during pregnancy, labor, and birth. I would like to walk you through some questions so people can understand also when did you establish this institution.
Yes, yes, yes. We are not hearing you.
You hear me now?
Yes, yes.
Yes. So this is what I was trying to say. I say what you have done is great, and the people of the world knows the importance of midwife. If they are trained, they will support and care for women during pregnancy, labor, and birth.
Yes,
And
yes.
and it is important for the people of Junub Sudan to understand when was this institution established. That's a question to Mr. Wall. When was the institution, this nursing school in Bar al Ghazal, when was it established?
Okay. This association was formed on 6th November 2021.
Okay,
That was when it was formed.
thank you for that. How many nurses and midwives have you trained lately?
Now currently the statistic is not that accurate, because back there in the village, there are no networks. When we try to communicate with them, because we have coordinators in a will, we have coordinators. We have two institutions in a will. We have Juba Health Science Institute in a will. We have our coordinator there, the corresponder. Also, we have in the same Will Town, we have Juba Science. We have a Will Health Science Institute. So those people, we have been trying to communicate with them to give us the accurate statistic, because they will focus on the villages deep down there in the villages to see how many nurses are there, how many midwiferys are there, but the network will not allow us to. The network, the challenges will not allow us to have the accurate statistic of the nurses and midwife there. But as for now, the whole country is having only 1,000 plus nurses and midwives. So they are not
Okay.
that enough. The whole Barghazal, I mean. Yeah. This question also will be explored to you later by Mr. President, because actually this is he is focusing on that
Okay.
topic. He will answer all the questions concerning this.
Okay. Okay. Thank you. I will stop from here based on your explanation. You
Yeah.
can go. So go ahead and finish, and then we will yield the floor to Malwal Ajun Bangrial. So go ahead, Mr. Wall. Finish what you were trying to say, and we will yield the floor to Malwal Ajun. Thank you.
Okay. Thank you. Thank you once again. First of all, I will talk on nurses. Nursing is a profession, and for a person to become a registered nurse, you must do a lot of exploration on the nursing profession. You have to go back to school. After you go to school, you enroll. You start from first year, second year, third year. If you are doing diploma, then you are graduated. Also, you can further your own for bachelor degree, particularly in the university. You go up to fourth year. Then you come out with Bachelor of Science in Nursing. So when you come out from the university or institution, you will come out with a well equipped with knowledge and the skill, communication skill, and so forth. How you will interact with people, how you will take care of a patient, how you will, as a nurse, as a trained nurse, there is a way, there is lifestyle that you are trained as a nurse. All these things they are gotten in a school. Back there in the village, yes, we have nurses, but to tell you the truth, they are local nurses. They are not that, they don't have that capacity, yeah, to handle the critical cases. You see? And so when the situation is, when something is not, for example, when they are given a particular task, or they are, I think there is music working down there. I'm hearing some music, huh?
It could
Yeah.
be Malwal.
Malwal, I tell him, let us, yeah. So what I'm trying to say here is that when you are, when a nurse who has not undergone, who has not gone to college or to university, is the one handling the case, then the little knowledge that he or she has will not be able, enable him or her to handle the situation at hand. So the life now is gone. Maybe the sickness that would have not killed the patient would kill the patient, just because the person who is handling the case doesn't have enough capacity to handle that case. And that is why we are engaging this, we are trying to engage through Banamsa to make sure that the enough equipment is made deep down there in the villages. Nurses are trained, midwives are trained with modern skills in order to handle, to serve our community back there. When they are trained, anything they will know, they will see any challenge, they will see, they will smile, because they did it in school and they have made a lot of practicals on it. And so it becomes easy and they will settle it. The reason why South Sudan is not like any other countries in terms of health section is because here we are doing common sense. But those people down there in the west or east or some part of Africa, they have gone beyond our beyond common sense, and knowledge can be acquired. We have those things here now in Juba. We have trainers, the qualified ones. What they need is money, and then they will deliver the services. And if we are able to engage them through Banamsa, they can train our people, and we will have more nurses, and then the life goes on easily. Now, we have people that have will to do nursing, but because there is no enough, there are no schools where they can train, and they don't have their own money to come to the city and be trained and go back to work in the community. That is the challenge why people are not doing nursing. Yeah, but if they were having some necessary requirements, they can apply, and then they will go back and serve our community. Do you have anything to say?
Yes.
Okay.
You mentioned that we train nurse for 3 years.
Be audible.
I heard you say your brief explanation is very, very nice. And I have to put some question across so people can understand. You said that a nurse can be trained for 3 years in that nursing school. So nurses have to go from 1 year to 3 years to complete their studies as a bachelor. I believe that's a bachelor, right?
No, it's diploma. 3 years is diploma.
3 years is diploma
program.
It's a diploma program.
Yeah.
Which is too long. Okay.
Yeah.
Is there a way nurses are trained 3 months or 6 months, and we categorize that like a certificate of nursing assistant, which is CNA for 3 months, and then take it from if somebody want to continue, another 3 months will be categorized as LPN, which is practicing nurse, and another one go for 9 months, which is will be categorized as registered nurse. Why is it not categorized like that? So people can help very quick, because it is too long for 3 years. There will be no help, because that's the high studies. 3 years actually in other countries is a bachelor. So why we don't categorize it shortly, so we can reach people in rural areas?
Well, there are a lot of challenges that might will not allow you later, because tomorrow is unpredictable here. You know, there are a lot of challenges that are facing the people. So if you get opportunity of studying yourself or taking care of yourself in school for 3 years, it is better than going for 3 months, 9 months period, and then you come back and you will never go again, because challenges will tie you down when you come back. So we prepare to go for 3 years completely, once and for all, so that when challenges rise back later, you will not be having another problem that you have not solved.
You know, the reason why I bring you to this program, myself, you know, in United States, we people change career based on where the jobs are available. You know, 2 years ago, I was in real estate. I managed properties, and also I went to school and I did what they call Cisco is a computer engineer. It's a networking computer system whereby you can configure and do some other things. But because of job wrestling in that field, I looked and I find out that health is very important. And then I changed and I took course, very simple course. It is called CNA. I took it for 3 months. Yes, I took it for 3 months. And I was taught so many things. And that 3 months in other countries actually can be even 1 year. It is compact. So that's what I learned. Health, if there are no doctors, if there are no nurses, if there are no midwives, it is good for us to come together and shorten the cost. So the one with less money can take 3 months. The one with a lot of money can take 9 months. The one with which his pocket is full with money can go for a year, 3 years. That's how it should be categorized. The one that you train with 3 months can help. They can help so many things. They can learn how to ambulate the women who are having birth. They can learn how to care for the delivering baby. They can learn for expecting mothers. 3 months is a lot. They can do that and they can help the country. 3 years is too long, because if you don't have any people to take up this job, you can shorten the cost. That's how I looked at it. So we will come back into this, answer my question why it is not shortened like that, and we go again from another stage. Thank you.
Okay. So I think I can explain briefly about that issue shortly.
Yes.
Excuse me, there is something I want to add there. You know, short courses are not bad. Short courses in situation like this, they are very good. And I also seconded it. I support that one. And that is why we formed this association called Banamsa. We want back there in our villages and rural areas, back there in our rural areas of Barhazal, we want to establish this system. We want to establish this system, but unless somebody is here in the city, he can pursue 3 years program. But back there in the villages or in the region, because our aim is not to do things here in Juba. All the things that we will do here is just to make connections. When we get funding, we will send them to to Barghazal. You understand?
Yes.
So what I am trying to say is that when we will see the situation, we will analyze the situation, and then we will see if there are people that are interested in enrolling for short courses. We will allow that thing, because that is exactly what we want. We want people that will be going for short courses and come back and serve our community immediately. That thing, there is nothing wrong about it. It is very important to have this thing. But anyway, we will have both short courses and 3 years courses when we establish the institution. Thank you.
Thank you. Thank you, Wal. You are based in Juba, right?
Yes.
Yes, I went to Juba last month, and my mission that took me to Juba, I was appointed as a coordinator, marketing coordinator of Great Lake University of Kisumu, and we went there to get students who will be enrolling in a certificate, especially in nursing. Some will be enrolling in community development, and some will do the IT online. Our aim is to go and establish an institution in Juba whereby midwives will be trained. So now, if I come back to Juba, we will connect. Sorry. If I come back to Juba, we will connect so we can help the people of Bahr el Ghazal to be given short courses which are well equipped with so many topics. You know, a topic, yes, with so many topics that can serve later when they go to the field. We will do that. I'll come to Juba, and if I have your phone, there are so many professors in a university called Great Lake University of Kisumu, whereby I had been appointed to be a coordinator. I want to coordinate the student of Juba, and then we establish the institution either online or on Compass. So this is a great idea that you bring forward, but what you're lacking, I can see, are short courses which compact together to be taught so they can give knowledge and an idea on how to operate a job, on how to do the job, delivery, nursing. So we will leave that from there. If I go to Juba, I will find you. So these are the courses. This is the flyers, and we will give you certificate. I mean, not certificate, an admission. So those we can even train people on Zoom. We can collect all the midwives, and we can create a Zoom, and we can train them on a Zoom. Not me, but we can find a professor from this university, and we can train them, and certify them. We will do that. Yes, when I go to Juba, if God wills, I might go to Juba. If there is something coming in the middle, then I will let you know. Something that will make me not to go, then I will let you know. So short courses have to be support, established, and keep going. So
absolutely.
Yes, because 3 years is too long. We cannot help people. 3 years. 3 years is too long. That scenario is now okay. We will talk about it when we are on the ground in Juba. Now, as you're talking here, is this program that you established, is it supported by the government?
Come again.
The institution, the Banamsa, the one you established to train nurses and midwives, who support it?
Well, this association was formed in November this year, last year, and an inauguration was done a few days, some time ago. It was done on 22nd of May. 22nd of May, We are in June, are we?
Yeah, we are in June.
Yeah, we were sworn in to office after in May. On May 22nd, that is when we took an oath for to the office. And the question is that who is funding the association? Well, association is a platform, and this platform we are receiving funding from whoever is willing, the well wishers. Yeah, even all of us, we are contributing towards it. Like as we are talking now, the money we spend on inauguration ceremony was too much, but it did not come from anywhere. It was from our own purse. We have the body composing of 20 something members. That body is the one that is contributed for the swearing in ceremony to be held, to be conducted. And the reason why we made it offensively like that, to call the media houses, to call big people from the government, is because we want people to be aware that Banamsa exists, and they will know that we are here. And also to let the government know that Barkhazal has started taking care of our people. Yeah. So actually, we are now engaging both everyone, anybody is engaged to support this association. We are receiving funding from anybody, including you people. Is that clear? Yeah. So that is what I can say now. We don't have the main source of funding for Banamsa. We are trying to collect the resources from whoever is willing. We are approaching people, the big people in the government, not only our Barkhazal government, big people, but also any South Sudanese who have a good heart to support the project or program that have been established, but young people. Yeah, so that is how we are doing it.
Thank you. Thank you, Mr. Wall. I will give a chance to Majok Makur Malak, the General Secretary of Lake State. So if you want to add something, yield the floor to Malwal. Thank you.
You're welcome.
Thank you so much, Brother Bol Makur, and thank you so much, the Deputy President, Wol Momo. Yeah, I'm really happy, and I've learned a lot through your conversations and discussion. You see, Mr. Wall, the health sector in our country is one of the vulnerable departments in the nation. And many South Sudanese are suffering because of this lack of health facilities, lack of qualified doctors and nurses, and also lack of medicine, the mere medicine. Let me just give you this little scenario. We just happened yesterday on your side.
Yeah.
Yeah, one of the women was about to give birth at the Payam level. Then she had complication during the delivery. So people had to organize for her transportation from the Buma
to the
town that is in Yerul, Yerul Hospital. Reached to Yerul Hospital and taken to the hospital actually, and she was about to deliver, and unfortunately the lady passed away. It is very sad, and that was not the only case. It happened in the month of January. I remember one of my cousin gave birth, and the daughter was around 1 month, not even 1 month, 1 week. And unfortunately, lack of health facilities and support nearby the villages, that baby passed on once she arrived to, they brought her to Yerul. Basically, I can say that you came up with a very good association. This association of yours is a platform where you can air out your views. You can give people civic education. People need to know what is happening in Barkazar region, what is happening back at home. Because many of these people from Barkazar region are focusing much and concentrating in Juba. And they're forgetting that the entire South Sudan, especially Upper Nile region and Barkazar region, are the most affected one. Even Equatorial region is better a bit. Because Equatorial region is near with health facilities. Although we don't have better system, at least they are nearby where they can acquire some medicine like Panadols. But Barkazal and Upper Nile need a lot of effort. And by saying that, it is actually, you put it correctly, it is our collective responsibility as sons and daughters of Barkazal, as sons and daughters of Upper Nile, and as South Sudanese to stand up and support anybody that come up with such ideas. My brother Wall, we are sorry to our viewers. The President Malwal is having issues with connectivity.
Yes,
that's why you see him off and on. But we'll proceed with our discussion. Bolmakur asked a vital question, that is the government aware of it? The same question, I will frame it in this way. Since you form Banemsa and in 2021 November, and you were inaugurated last month. So basically, you are almost even less than a month in the office. So what are your priorities as the organization or as association? What was your target? Because when you form something like association such as this, you must have objectives, aim, vision, and mission. What are those aims? And what do you want to hit, or what do you want to help in Barakazal, especially in the health sector? Do you need more nurses in Barakazal? Do you need qualified nurses? Do you need the nurses that are actually working now in Barakazal to be trained? Or what really do you want?
Thank you. Now here, there are our aims and objective of forming this association. Yeah, I think that question, I can answer it, but if I answer it now, you know, my chairman now is having issues with connectivity, and maybe this question is for him, and I will answer some part of it, because you know my topic here is focusing on nurses and midwife. Do you understand? Because in that your question, you asked me that, how do you want to have more nurses? Do you want to train a lot of nurses in Bar Hazal, or what are your aims, sir? Well, our priority is to have more nurses, and that is why we are saying that we want to establish an institution. We want to start. We want to start with, for example, the other day we want to engage the Ministry of Youth, because you asked me that, is the government aware of your organization or what? Well, it is now 1 month. We have not even finished 1 month. On 22nd of June, that is when we are going to close 1 month. But somehow our voice is louder than the time we spend. You see now, a lot of things that we have been a lot of the steps that we have taken, they are very sounding. The government is going to be fully aware of our Banamsa by engaging this Ministry of Youth, because here people have mistaken a lot of associations, because actually associations are the ones that promote this corruption in this country. because you will enter the office. By the time you come out later, you come out with money. And where is that money for? I mean, which money? When they gave you the money, the owner of the office, the person in charge of that office gave you money. So I think we will not touch that part. But because of that one, that is the reason why all the associations are locked out. You want to enter to see the person, the minister, you want to see the director, you want to see whoever you want to contact in his office, they will not allow you. It's not that easy. Why? Because they assume everybody to be making money. Yeah. But
Thank you, Wal.
since we are doing awareness, we want to go through the Ministry of Youth and Sport, Dr. Albino Bolbio. We want to use him to be taking us from office to office, from office to office, with our project written on the paper, aims and objectives for that project. We are going to put it in a documented paper, in a documented manner, so that when we get down there, they will know that this is our aim, these are our objectives, and how best they can come in and support it as the government. So that is, we have not known, the government does not know us fully now. But when we get to Dr. Albino Boldio, or when we go through the Ministry of Youth and Sport, because we are youth, yeah, they will take us to whoever we want them to know us. Yeah, so it will be aware.
Thank you, Wal. Yeah, before we go further with you, let me give this chance to your chairman, Brother Malwala Ajot. Your internet is not that stable. Kindly, you can take the floor and give us your perspective, your objectives, and your data that you have collected. So you can activate your mic, and you are welcome, Malwal.
Yeah.
Well, the floor is yours.
Okay. Thank you. Okay.
Sorry, our viewers. The network is always our challenge whenever we are in conversation with a guest from Juba. And if you are in Juba, you will understand how MTN is mistreating South Sudanese. So MTN have no different now. MTN has no different with the challenges that South Sudanese are facing in the country. Yeah, Brother Wall, we will move on while we are waiting for your chairman Malwal to come back. Then we'll give him another chance. There is a point here which was raised by Bolmakur. You have said clearly that your target is to mobilize funds, mobilize people to support you in order to establish a nursing and midwifery institute in Barakazar region, where all those nurses and midwiferys personnel will be trained. That's what you said.
Absolutely.
And for that regard, I just want to know, do you have like in mind, see when you establish something, you always have it in mind that I have to establish it in Wow, in Awil, in Rumbek, and also in Warab. Is there any state among Barkazal region states that has an institution of nursing?
Yeah, as we said before, we have in Awil, we have in Lake State, we have in Wow, we have also in Warap. We have in Warap here. Yes,
That's very good. That's very good. If we have
yeah,
those four,
but those
institutions.
four institutions, they are not four. They are little a bit many, but they are not enough compared to the population we have. Yeah.
They're not that effective and efficient.
Yes, and all those ones, yeah, they can deliver quality services, but they are not enough compared to the. As you said before, here before you said there is something you said before, that there is an incident that happened in Lake State in Europe. A woman was pregnant. She was taken to the health facility, but there was transportation challenges. When she reached the place, the hospital, because it is little bit far from the village, the child now was delivered and the mother died. Why? Because the ones that we have, they are in the towns, in the main town, but not down there deep in the villages. But if we have them in the counties level, at least they can help people in time of need. So
okay. Another thing, I just want to add some few plants here for your. You will add them up to your ideas, like what Brother Bol put across before, that he can use his network with the Great Lake University of Kisumu to have that connections and connect you with some of the professors and doctors there. Yeah, that is the pamphlet.
Yeah, that is the flyer.
Yeah, he said he can connect you with those professors to train some of the nurses that you may select from the region, and they can use Zoom. Basically, since COVID-19 emerged, the entire world reduced the live conferences and they go on virtual. So you take note of that, and you have to utilize his network. Secondly, those few nurses and also the midwifery's personnel that were graduated or that just graduate in all those universities, Upper Nile University, University of Juba, and other private universities there in South Sudan. So do you have any intention of organizing a training? Because I understand we have institution of nursing in all Barkazar region, but what is lacking is the equipment. These people are not equipped. Some of them are even primary school dropout, others are high school dropout. And these people are using their experience, but they don't have a skill.
Yeah.
And to have experience is different from having a skill. So kindly, I'm urging, if you base your organization on this angle, you go like, if you go to Lake State, you contact the Minister of Health in Lake State, and you tell him or her that we need to come and visit the institution, the nurses. You go to the nurse, you talk to them, and you let them give you around 5 people, 3 gentlemen and 2 ladies. Then these people, you hired expert, 1 expert or 2 expert to train them. Or you contact Bol will contact his professors, and then these people will be trained on virtual. Like even now we are talking, they can be trained. Like so this. By that training, whatever skill they will gain on that little training, they will invest it and they will help people in the state. And then you move to will contact your representative. And also in Juba, you can organize training of final years student. In nursing. Finalists. You organize a training, you bring them together, you go to Juba Teaching Hospital, you go to Gieda Military Hospital, another private hospital there. You talk to the doctors and tell them we need your support, just voluntarily. 3 to 4 people will volunteer. Then you raise some few money, or you go to one of the Barkazal sons or daughter to pay a hall in among those hotels there in Juba. Then you bring these students together and bring the expert to train them. If you start your activities on this base, up to the end of the year, then the NABDA or the BANABDA will have been at the higher speed and everyone will be aware of it. Then the second space is after you write your proposal of establishing institution, then you will sail it throughout those training. This is what I cannot, Malwal is here. Malwal, kindly, can you just come in with your thoughts?
Yeah, sorry for this.
Okay, thank you. There is a problem of internet here in where I'm staying, and it is my privilege also to be welcome second time after the pandemic. So that's why we were looking possibilities of scheduling the time. Yesterday, as I text you, but it was not possible because we were very late. So before I proceed to the topic that I'm assigned, I would like to answer or to add a certain description on the two questions that were asked. How many nurses are in South Sudan? How many nurses and midwives are in South Sudan or in Baragadal in particular? And then the category of the nurses and midwives. Because before I hear my
Sorry, our viewers, bear with us. He might be back again. Those are the challenges of young nation, and we must bear with them. Yeah.
So the network is really challenging, actually.
Your network is giving your friend hard time.
But it is well. It is well. Yeah.
So basically, that's what I was thinking to add on. But it's a very good idea. You came up with a very good idea, and they will be supported. They will be supported, and many people will buy that idea. What you just need, what you need to do is to consolidate your ideas, consolidate the project, and prioritize them. Which one should be the priority by the end of 2022? What do your organization and leadership need to achieve by December? And then you put them in that order. You prioritize. If you want to train the nurses, then you go for it. Then you'll be looking for funds and finance to train them. Once you get finance, kick the training, kick the training, kick the training. And through that, if you go to the states, the state government will be in a position to support you too. Because you are not doing something bad, because you are bringing on experts to train the few nurses that are actually helping people in the state level. So the Minister of Health at the state level.
Hold on, please. And talk interview, please. I will call you.
So
yes,
that's what I can add. I will yield it back to you. If you have something to comment, then Bol will come in.
Yeah.
Yeah.
Before you come in, I just want to give him some house maintenance. So, chair of Banamta, if somebody call you on your cell phone, go ahead and mute yourself. Then you answer your phone.
Oh, yeah. Thank you. I'm sorry. Okay. Yeah.
So the people on the audience.
On the,
but you know, is a step by step
Absolutely, yeah.
Yeah, you are great. So it's a step learning. Yes. Before you go, you know the reason why we talked about Great Lake University of Kisumu is that we have very qualified professors at the Great Lake University of Kisumu. And since we are bringing our facility to Juba, it is very easy for a good number of midwives and nurses to be brought into the class and train them at a short time of at a period of 3 months, and then put them to work. That's why we want to come in and give training to our midwives and nurses briefly, so they can go and help. Then after somebody accumulates his little pound, and then can come back and proceed with the long training.
Studies. Yeah.
Yes. So that's why we want to come in with the professors from Great Lake University, so we can train good number of the nurses. And then
nurses, yeah.
Yes. Thank you.
That is absolutely very wonderful. It is very wonderful idea. We welcome it, and these are the tools. Actually, these are the tools we are looking for in order to move forward as Banamsa. In order to bring, it is really stated before here. My brother Majong Makur has stated it before that. Do you have the picture of that project you have, you want to do in your mind here? Actually, everybody is having a picture of that one, because the way we have painted that picture is really it is something that we want to be put on the ground for people to believe on it. Yeah, we have the picture in the mind. We know exactly what we are talking about. We know how we are going to start it. We know the procedures and how we will finish it. It is there. What remains now is the funding. Once we get the funding we want, automatically, it is not actually yesterday that we had a meeting, executive meeting, chaired by the president of the association, and the people commented on this project, and they allowed it. What it remains now is to embark on that project, and once we embark on it, that is exactly when we will you will see that the project we plan for is really a great project. But I know you have already believed in us. Yeah, and that is why the deputy chairman of the Lake State Media has come in with how he can help us. You understand? Yeah, so we have the picture, and the picture is very well painted. We know the beginning of it, the foundation, the foundation, the ankle level, the waist level, the upper, we call it upper limb level, and then the end of it. We have it. The picture is already there, and where we can locate this thing. Yeah.
Thank you so much, Wal. Your friend is here, the president, Malwal.
May I get interrupting here?
Yeah, Malwal, take over. Yeah.
Actually, I don't know which network is he using. Yeah.
I guess he might be using Wi-Fi.
Oh, Wi-Fi. Yeah, I think he's in hotel.
Because if he's using laptop, then I think he's using Wi-Fi. That's why.
Is it difficult for him to connect?
Yeah, he tried to log in through his phone, and his phone is having enough MBs to run the show, but it's giving him a time. Yeah, take over, Malwal.
Well, I'll take over. Can you try maybe to unplug your headphone? Probably be clear. Or if he's
thank you very much. Okay, thank you. Before I proceed to the discussion, I would like to request, if possible, I can make audio instead of the video live.
okay. You want
It's
to have
allowed.
an audio? Is allowed. You can go ahead. Anybody are speaking in the background?
Me?
Yes. Yeah.
Unmute yourself, Wall.
Yes. Are you saying?
I'm saying you can
Yes.
mute yourself. Wall.
Yes. Can three of you hear me?
Yeah, we can hear you, Malwal. We can hear you. You can go on.
Okay. Okay, thank you. I would like to respond to three questions which were asked to my Deputy President, Mr. Wall. The question are ranging from how many nurses and midwives are in Bargadal, and then what is the origin of this station, so that other people who might have not heard it can be able to hear it today. And then the third question was about why can't we have a category of nurses and midwives? What do I mean? People from nurses and midwives from certificate, from diploma, and then 3-month training, what we call traditional birth attendants. So I was facing some difficulties in internet hearing where I'm staying, and if I misfire some of the questions, bear in mind that it was due to the problem of network before, because I was not actually in position of listening from the question properly. So from the origin of this association, there is a reason why you form a certain organization. And I would like to summarize into 3 points, because
I think it's very good in speaking. Only the problem is the network, of which I want to come in and kick that network. Yes. I'm just kidding.
I think what we can do.
Yes.
Yeah,
we can.
You can call him through the phone. Yeah, and just let him talk through your line.
Okay, how are we going to do it?
The most important thing is for him to pass the message to the public.
Okay.
Yeah, but he can speak through audio.
Only on your just normal MPN line.
Yeah. Okay. What I will do is,
and you increase you make your volume loud.
Let me support. Let me support the volume. I have the Bluetooth here, the big one.
Right.
I will connect it, and then and then I will open it loudspeaker. He will make presentation. He will Thank you. Wait,
right.
give me a minute.
All
Okay.
right. Yeah, Benbol, you can play the song.
Okay. Let me see. Let me see if I can bring our own. I think Malwali struggled to come back.
I guess.
Malwal,
Guys, yeah.
Yes, yes.
okay, go ahead right away. Continue.
Okay, okay. So the reason why we formed this Banamsa is a summary to be made in 3 points. Number one is about the data that we have collected in terms of nurses and midwife, or in terms of health workforce in Bargadal. This is one data. Number two, also we collect data based on the medical schools, the nursing schools that are existing in Bargadal. That is the second data. Then the third one is about upgrading. Like if you have completed diploma in midwifery or in nursing, so where can you upgrade it? And those were the 3 points why we came up with this Banamsa today. So in briefly, one by one, when we collected about the health workforce in Bargadal or in South Sudan in general, before I go to Bargadal, since 2010 up to the present 2021, the number of nurses and midwives which are trained in the whole South Sudan were 1,096 since the time when Dr. Riak took over the Ministry of Health before he was removed and replaced by Honorable Achwe and the current new minister. So from 2010 up to 2021, South Sudan was having 1,096. Now, seeing the other nurses and midwives said recently during the examination until they completed on 10th of June. Now the whole number sum up to 1,550 nurses and midwives. The registered one. What do I mean? I mean those who have bachelor's diploma and above, because we are not considering certified nurses or midwife in this category. So when we come to 1,550 nurses and midwife, including the current students, which their results are now still under marking, Baragadal as a region has less than 300 nurses and midwives. Now, if you see this big gap, there is a role to be played. That's why we formed Banamsa to talk or advocate so that more nurses and midwives are trained in Baragadal and also in Upper Nile and South Sudan as well. If you divide this, let's say 300 nurses and midwives in Baragadal, and the population according to the census of 2008, Baragadal have 4 million people.
The network is crazy. He's making sense. The network is crazy. Let's analyze while he's away, General Secretary. You know, when I went to Juba, I went to Minister of Health with Great Lake University of Kisumu professors. And I met a great gentleman called Stephen Abraham. When we went to the Minister of Health, I met one of the great ladies who is in the office, and we talked, and they talked about PhD and master's student that they sponsored and took to the University of Great Lake and educate them. And this lady came up and told us that when they taught these great degrees, they came to realize that they have let down the people of Sudan. Why? Those degrees went and find great jobs somewhere, but not in Sudan. And that's
Hello?
why, yes. So go ahead, take over.
Hello?
Yes, we hear you. Take over. Malwal? Malwal, you can take over.
Okay, thank you. So from the population of 4 million, if you divide this yes, yes, yeah, thank you. If we divide this population of 4 million to the number of nurses, which I yes, I'm now talking. Are you hearing me? Yes.
The network is a pain in the eye. So we keep analyzing while it's coming back. Then she told us that actually South Sudan now is looking forward to educate nurses and midwives because we're lacking nurses and midwives. We pour money on high studies, and then we left very important certificates, very important diplomas, and very important bachelors, which South Sudan should have focused on and educate from certificate, diploma, and bachelors. So it was actually not a good vision. Go ahead.
Yes. Okay. Now from if you divide 4 million with the number of nurses and midwives, which I say approximately to be 300 nurses and midwives, you will see that one person is going to care more than 10,000 patients. And yes, I'm hearing you. And the capacity which the nurse or a midwife is supposed to care are only three patients or the three clients that you are supposed to manage, either in the clinic or in the
The network again kick our buddy out of the house of Lake State Media, but he's coming back shortly. So bear with us, our audience. Unmute yourself, the deputy chairman, the deputy.
Corona. Do not speak.
He is trying to connect him.
Yes, I realized that.
It is very sad, Deputy Chair, to hear that the entire country, like South Sudan, is having 1,500 something nurses. And the nurses in South Sudan are even less than the nurses that are running Nairobi Hospital now in Kenya, where you are. Because 1,500 is nothing. These nurses cannot run the entire country. So basically, there is a lot to be done, especially on the health sector.
Yes.
Through government, through community fundraising, and through well wishers, and also student body like their organization, at least to sensitize public, because it's disappointing. The whole of South Sudan to have 1,500 nurses. Go on, Malwal.
Yes. Malwal, go on.
Okay, thank you. So if you divide this population, which is 4,000 with the 300, you see each nurse or a midwife is going to care for more than 10,000. And the real capacity that a nurse or a midwife is supposed to care in any clinic or hospital is only three patients. If the condition wasn't, you are supposed to care for 5 patients or clients that you are supposed to manage. So Banamsa came up to talk on this gap so that more nurses and midwives are supposed to be trained in Bargadal and also as well in Upper Nile region, because these are the two regions that are having inadequate number of nurses and midwives. Or in summary, these are the two regions that have a big problem in healthcare sector, ranging from the health workforce, the number of medical schools, and also the capacity in terms of manpower. So this is the one data. The second data is about the number of medical schools that are training nurses and midwives in Bar.
Our viewers, you can bear with us. Network is disturbing him, and he's really making a good point. He's trying to give us the data and the statistics of what is actually happening back home or what is happening on the ground. And it is good. But let's just wait and hear from him. Yeah, Deputy Chair.
Yes.
All right, he's here back. And also Wall is there.
Mm. Go ahead, Mr. Malwal.
Yes,
Go ahead.
okay. Yeah. So if you see, okay, if you see the number of medical schools that are in Baragadal are very few compared to Equatorial as the region. Like for example, when we talk
Corona.
specifically, we have only 6 medical schools, which include Rumbek Institute. We have 3 institutes in Wow. Then we have Awil and Kwajok. These are only operating medical schools that are offering diploma or a bachelor degrees in nursing and midwifery and other courses. So Banamsa came up to advocate for this gap where we have inadequate medical schools that are supposed to be established in our region. Like for example,
Yes. So the network is taking our body away, which is very sad because it's making more sense. But let's uh, have a patient, because patient is the best chibum for men to live. Um, Deputy General Secretary of Lake State Media, we would also like to advise our. Go ahead, Malwal, right away.
okay. So if you see there is inadequate medical schools that are in Baragatal, that's why we came up to advocate for this big gap to be fulfilled, either by the people of Baragatal themselves or by the national government of South Sudan. This is one. This is the second data. The third one is about in case if you have completed from bachelor's or diploma, for example, someone who is doing midwifery, you are done from diploma, you will be having nowhere to go for upgrading. Why? Because there is no any medical school, either from Upper Nile or University of Bargadal that is offering a nursing degree. It's not there. So we came up with the Banamsa to advocate or to enlighten the people of Bargadal in particular, our 5 governors, because we are considering the chief administrator of BI to be also as a governor, so that the 5 governors of Barakadal listen to the voice of Banamsa to make sure that someone who has completed a diploma in midwifery go for upgrading. And you cannot go for upgrading without having a school that you can enroll for. It's either for the government to do the two things, either to build a school that can offer the diploma and a degree program in midwifery.
is Mr. Wall, since your chairman is fighting with the network.
Yeah, Yes.
Yes. Yes. Are you hearing us, Mr. Malwal? He cannot hear us. They need to connect their mic. He cannot hear us.
I
Malwal? Yes, go ahead right away.
For scholarship to be offered to students of Bahragadal and other regions like, for example, Upper Nile and Equatoria. So these three summary points are the reason why we formed Banamsa to advocate for more nurses and midwives to be trained in Bahragadal, and also to educate people that there is inadequate medical schools that are in Baragadal, and also offering scholarship to our students so that someone who has completed diploma can go for bachelor's. That is the reason why we formed Banamsa. And it was very clear stated before that Banamsa was formed last year. And it started actually on June 2nd, where we sat as the students of Greater Baragadal to brainstorm about how we can have a medical station in Baragadal. I remember Banamsa is the first medical school that is existing in South Sudan on Baragadal side. So the question before that, why can't we have initiative of training people from bachelor's, diploma, and certificates? You see, in every country, there is a level of qualification of a certain specialization. So here in South Sudan, the government came up with a policy of making sure that we have competent nurses and midwife. Competent nurses and midwife ranging from someone who have completed diploma program and above. Since 2010 up to the current 2022, the government embarked first on the point of having enrolled midwives from 6 months training up to 9 months, up to 2 years, because our system of education was not actually standard like the other countries like Uganda and Kenya. So that categorization is still existing, and the government is going to focus on a diploma program or a diploma category of people who are supposed to enroll in nursing or in midwifery school. So that one is made to ensure that a country or an area have number of nurses and midwives, because the economic status will not be the same like the whole citizen of a particular region. So as someone who can afford 6 month or 9 month or 2 year program can manage. Someone who can afford 3 years or even 4 year bachelors can afford. That category is there. So I would like to come on the point of what I supposed to present it today.
Yes, the network is violently fighting him, and he's making a great point. But one thing, Deputy Chair, one thing we need to understand on how people work. You know, people always work in pair. You know,
Yes, yes.
Yeah.
a certified nurse can work with the registered nurse. So each and everybody have a duty, you know,
To play, yes.
and that way there are things that a certified nurse, which is a 6
Hello?
month. Go ahead. Go ahead.
Yes.
Hello?
Yes, yeah. We are hearing you.
We hear you. Go ahead.
Hello?
Yes,
Can I
we
pick
hear
up
you.
from there?
Go ahead.
Yes, can I pick up from there?
Yes.
Okay. So let me briefly go on the topic which I was assigned today, the origin of Banamsa. Yeah, the origin of Banamsa and our mission to healthcare system and also to nursing and midwifery education in Barakadan. Already have explained
Sorry, our audience. You know, network in Juba is a little bit hectic, but bear with us. So he's getting himself. Okay, he's back.
yes. So I have already talked before about our origin as a medical association in Barakatal, and I would briefly talk about our mission in healthcare sector and nursing and midwifery education in Barakatal. You see, we have a strategic plan of how we can contribute to these two, ensuring that we have number of nurses and midwives which are enough to take care of the patients and the client in medical centers, and also to contribute to the health system in Barakatal. What is our mission here? Our mission is very clear as a association or a Banamsa. So let me specifically be talking about nursing and midwifery education. What is our mission, or what can we contribute as a association in nursing and midwifery education? Our contribution are ranging from many things, which include the one we were discussed yesterday in the executive meeting, which I shared by myself. So we came up with a strategic
It could be an area where he is also have a problem. Network, network,
Yeah.
uh, uh,
Yeah. Yeah.
your network can be fluctuating. So it could be an area where he is. But anyway, we are almost So we will be waiting for him. It will be done before the date.
But what should I call him? And then
I realize that he don't pick up. I realize
he
that
doesn't speak. He doesn't speak, but I think
yeah. Go ahead. Let him go ahead.
Yes. Our strategic plan in nursing and midwifery education are very many, and I will be in position to tell you one by one. The one strategic plan of ensuring that we have nursing and midwifery education that are capable of producing number of nurses and midwives is, of course, the project that we endorsed yesterday in our meeting, that we will be having a project of nursing or a medical school that is going to be established in Barakatal, depending on any area that we will assess. That project is already assigned to the Secretary General in collaboration with the Secretary of Health, and they are working on it. After we have completed that project, we will sell out to everybody, whether you are within South Sudan or you are outside South Sudan. We will sell this project out when it is ready. This is our plan in terms of nursing and midwifery education. One, if this project get funded immediately, then we are contributing to a nursing and midwifery education, because this school is going to 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 graduate a number of nurses and midwives and also other medical personnel, because we have other people who may be studying uh, public health, clinical medicine, and others. So this is our plan. And when we secure this school, if we secure this school, it will benefit people in many things. And I will summarize the benefit of this school into three. The first benefit is that it will create employment. Like if if I have completed already my diploma or I have graduated from my studies, I will find a chance of going there, you see, for upgrading. This is one. Number two, also, it will create employment to other students that have already completed their bachelor's in nursing. They will be in position to come and teach in diploma program, because someone who is bachelor degree is eligible to teach a diploma class. So it will create employment. Then it will offer a chance for a student to study in terms of partial scholarship. What do I mean in this point? Like if the tuition fee, for example, is 100,000 in private sector, a student will pay half of this 100,000. 50,000 you will pay, and then 50,000 will be paid now by the school. This is the benefit to the students. These are the three benefits that such a particular project will offer to our people. Now let us come back to the project of a specialized clinic. This specialized clinic will also create the same benefits like what I explained before, creating jobs to the people, and it will also manage, some cases in the community, either ranging from communicable or non-communicable diseases. It will also help in management of some cases. And you know very well that the maternal mortality rate in South Sudan is very high, according to the recent study that is conducted. 789 women are dying every year. And this number may be quite high because the study was not done comprehensively. It has not covered the whole facilities of South Sudan or the whole area. And the number of deaths of the general population is 4,896. These are the people which are dying every year. on disease-related cases. Now, if we have this facility, that is a specialized clinic, it will help in eradicating this point of maternal mortality and the death rate in South Sudan. This is our strategy of fighting for the strong nurses and midwives that are capable to deliver health services to the people. And also, it will find an opportunity for us to enlighten the community, because we will use this session to advocate, like in the area of nursing or midwifery school in Baragadal. Let me talk briefly about the number of medical uh, schools that are functioning now in Baragadal. So we have Rumbek Institute is working. We have also a will. We have WOW has 3 medical schools that are working. Then we have also Kwajok. These schools are not inadequate to 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 let's say to make an intensive uh, education to everyone. Intensive education, it means that everybody should have access to nursing or midwifery education. If we are talking about the point of nursing or midwifery education, this school will not be enough to every person that need uh, qualification in nursing or midwifery education. So the Banamsa is taking role on that to make sure that we work on the 2 projects, the school and of course the specialized clinic, which we are very grateful that they will succeed in terms of getting funds. Hello?
I think
Hello,
yes.
boy.
Go ahead. The fans are on. The public is also hearing you. Continue.
Okay. So this is our contribution as a session toward nursing and midwifery education in Barakadal, and also in terms of health workforce in Barakadal. We will write the projects. This is strategy number 1. Number 2, we will be taking role in advocating to the people of Barakadal about the importance of nursing and midwifery education. We know very well that there is a belief in 2 regions that someone who is doing nursing is just about cleaning wounds and so forth. So they did not know that a nurse or a midwife is also an important professional health personnel that can contribute to delivering health services. So the Banamsa will take role of advocating or educating people about the importance of nursing or midwifery education. Like for example, if you go now to other parts of our region, the recent data that we have collected, in Upper Nile, for example, we don't have students of a BA that are in nursing department. You cannot get. Also, you come to my school, we don't have students that are doing either nursing or midwifery in a will. Also in WA, they are not there in the school that I'm studying. You see? So what was the problem of people not enrolling in nursing or midwifery education? The problem may be money, but I will talk on the 2 things that I thought to be the reason. One could be the ignorance of our people. As I stated before, that our belief at the community level is that a nurse is someone who can just deliver minor services like dressing wound or wound dressing. And for example, a midwife is all about someone who is delivering a mother. But also a midwife can play an important role, or a nurse can play an important role, like the other role that can be performed by a medical doctor or a medical assistant that we call clinical officer. Like, let's say if a midwife or a nurse is trained properly, it has all the skills, the knowledge, and the emergency came in the absence of the doctor, a nurse or a midwife can take a role of managing that particular patient until the doctor arrives or until the call is answered. You see? So the Banamsa will take a role of advocating to our community of Baragadal that nursing and midwifery education is very important. Like, I could just give an example. In the last year, 2021, Canada transported some number of nurses to Kenya. You see? A number of nurses were trained and they were transported to Kenya to come and fight or help Kenyan health personnel in terms of delivering health services during coronavirus. How was this important to Canada? Canada was getting a number of resources, like the budget which was given to Canada to pay back the help that Canada did. You see, it also promote a Canadian image of making sure that they have a strong health system in their region. So it became a challenge to Kenya to transport number of nurses and midwives from other countries to their country. Why? Because they did not prioritize nursing or midwifery education in their country. The same thing is obvious. It is automatic and it will happen to South Sudan. And how can we prevent it? Is by prioritizing nursing and midwifery education in South Sudan. This is the one. Also, for the government to raise funding. Like, if I may surprise you, the funding that is given to Ministry of Health is only 1% from the whole budget of South Sudan. If you see this 1%, and we have 1,550 nurses and midwives, you see this is a big gap. So for us to ensure that we have number of nurses and midwives in South Sudan or in Baragadal particularly, is what we came up as a session to be supported and to be endorsed by the government, and also to raise funding. Because the Ministry of Health cannot operate without a budget. You see, every ministry needs a budget. So we are also calling on the government to release adequate budget to the Ministry of Health so that the Ministry of Health can be able to execute the roles that the Constitution assigned it to do. The roles of ensuring number of health personnel are enough, number of medical schools are enough, then the strategies to fight against diseases, either communicable or non-communicable diseases. This is a strategy that we are embarking on to advocate, and we will use the law to advocate for the government to release adequate funding to Ministry of Health. The good thing is that we have a chairman of the specialized committee in the Transitional National Assembly is there, and we are making a plan of meeting him so that we discuss the same issue with him as a chairman of a specialized committee. Yes. So this is our call, and this is our strategy.
Yes. Go. Finish your point. I just want to do a follow-up question.
So this is our strategy.
Yes.
Oh, okay. Yes,
I want to do the follow-up because your network later will be a problem. So there is a follow-up question need to be asked. Go ahead and finish so we can end this very quickly.
Thank you. Okay, thank you. So this strategy will use law as our strategic plan to govern through the Committee of Health that is in the Transitional Assembly, and will also visit the state ministers of Baragadal, of the four states plus Abia. We'll visit them and share the same idea or the same information to them. This is what we have, and this is how we also help you as the state ministers of health in Bargadal.
Thank you.
So these are our strategic plans that we have in nursing and midwifery education, and also in healthcare in Bargadal.
Thank you. Let me do the follow-up question, very quick, brief question and answer.
Yes,
I follow up your speaking. I followed it up, and I was
yes,
very pleased that you mentioned when you create Banamsa, it will work very hard to create employment and also
yes,
work in the health sector. But I did not
yes,
hear one very important thing, because if you have
yes,
trained somebody, you have also to know where this person is going to work. I did not
yes,
hear you that Banamsa also will build a small clinic in the rural areas and then put those you train in those clinics. I did not hear you saying that. Why? And that's a very important reason you should train nurses, because even if you train them and you just accumulate them in school to work for school, then the
yes,
vision
yes,
is lost, because their vision is not to be, for them, it's not only to be accommodated to work in school compound. Their job
yes,
also is to be spread in those small clinics. So I did not hear you saying that Banamsa also will encourage and build small clinic in villages to go and educate, to go and work. And this is where we can meet pregnant wife who cannot travel long distance to come to the town. I did not hear
yes.
you talking about that. Can you talk about it?
Okay, thank you. So it might be the problem of network, as I stated before that we have planned two projects, a project of a clinic and the project of a medical school to be established in Baragada. These two projects are ongoing, and I repeat again that they are ongoing. The Secretary General and the Secretary of Health are spearheading this work, and they will be finishing as soon as possible. So this medical center, that is a specialized clinic, one, it is supported or it is funded immediately, and it is built. You see, the very people that we have graduated either in any medical school will have opportunity now to go and work there. They will deliver services to the community, and they will also be supported, you see, by that specialized clinic or the health center that we are proposing to be constructed in case we get the funding. So it will help the student in terms of employment. It also help community members or societies of Baragadal in getting services. Like for example, like if we go now to Abia, we have two counties that are not even have any primary health centers in Abia. We have Mijok, it's not having a primary health center in Abia. Now, if we use Abia, for example, to be the area to take the project or to have the project be put in their place, it will also help the people of Abia. Like if I may use Abia, or I may use Gog Machar, if Gog Machar is the one to win that project in a will. So it will help the students to get supported, because that clinic will also pay them, you see, and the community will be in position to get services. Because when it is constructed now, the community will be able to come and access health services instead of traveling to a will center where we have a number of hospitals, which is the state capital now. So this project I have already talked about, and I would like to repeat it again, that the project of specialized clinic, and by the way, it was the first project that was passed by the Council of Secretaries or Executive yesterday during our meeting. They say that the first project should be a specialized clinic or a clinic, because why we are making it to be a specialized clinic, it also delivers some intensive services, you see, to the community. It will not be having a level of a capacity of primary health care center. So we plan to have an intensive specialized clinic to offer some intensive services of healthcare to Barakadal. So I have already talked about it before, and I repeat it second times.
Thank you.
It is the first, it is the first project that it was passed to have a clinic.
Thank you. Let me ask you some. You hear me now, right?
Yes, I'm getting you.
You know, we are very excited for this show because the topic we are talking about today is very important to the people of Junub Sudan and other people of the earth, because a lot of people are not familiar with the health sector, because people are concentrating on politics, people are concentrating on IT, and people are also concentrating on civil engineers. And it is good that we should talk about health, how we feel about our mind, health, body, and all part of the human body that make it life. Let's come back to the problem of nurses. You know, you said something very important. You said that nurses are not very common because of our mentality. Because more people think that nurse is somebody who just only cleans wound. But nurse is very important, and it is also categorized into many groups. There are nurse. Nurse could be somebody after a doctor sees the patient and prescribe the medicine, then the nurse will take over and give that medicine to the patient. So that's after the doctor sees the patient and knows what's going on. Then the nurse will take over and inject that medicine into his body or her body. That's a job of nurse. And with this nurse also, there will be another assistant nurse that will be having another job. We will take care of the wounds, of which you said, or we will transport patient. That's another one. Safety procedures. That's another one. And that nurse will also assist with some medical procedures. There's another nurse under that nurse. Stocking hospital supply, cleaning rooms and bed linens, documenting information, answering patients' call, checking vital signs such as blood pressure and heart rate, feeding patients and documenting their food and liquid intake, grooming patients by brushing their hair, teeth, shaving them, etc., bathing patients, gathering medical supplies, and turning or moving or ambulating the patient. Some of their responsibilities are many. So it is this work of the work of hospital is categorized. And if people are right away from the doctors and everybody want to become doctor, and then the clinic will not run at all. The clinic will not run at all. So we want to encourage people that it is step by step until you reach the stage of being a doctor. Also, the student, when the student are still in school, not having their bachelor's, not yet achieving their diplomas, they can also work under the category of a nurse while they are going to school. They will do all those while they are going to school. And remember, There is no doctor who will become a doctor without knowing what are the steps of cleaning a wound. Do you have any doctor like that on earth?
No. It's not
there
that.
is no. Yes.
Yeah.
So we need to let the public understand that everybody who become a doctor knows how to address wound.
Yeah.
It's just the same time as somebody who become a president knows how to answer 1+1 when he starts in school. You know,
Yes.
it did not start from simultaneous equation right away.
Yes.
So people have to understand that it is a stage by stage. Even me today, like I told you, I did certified nurse assistant. If I go now to Marialba, which you talked about, I will even be interested to address wounds.
Thank you.
What is wrong with that?
Yes.
I will be even interested to ambulate the patient. I will be even interested to clean the patient face. What's wrong with that? And I get there, other gen bitana nas bitana command bichiti nas for America and nas for America they clean wounds. If you want to become a doctor, what are you going to do? So people need to stop this assumption of thinking that we know something, including me, and we have to do the important. If you tell me now, Paul, go and do the vital sign. I took the nursing class. Now ask me, what do you do when the patient came to your hospital? What I will do first, before the doctor sees the patient, I will have to know how to take the vital sign.
Very good.
I will take the temperature. I will take the pulse. Okay. When you touch your hands right here, touch your hand right here, everybody. Okay.
Yes.
Touch your hands. Now I am a nurse. I'm a CNA. Touch your hands right away. What do you feel?
Yeah.
That's the pulse.
You feel the pulse.
Yes, you feel the pulse.
Yeah.
Yes.
The pulse rate.
Yes. You feel it, right?
Yeah.
Yes. So will you find a doctor on earth who don't know how to find the pulse? Because that pulse is in a stage of certified nurse assistant. That's being foolish. So all the doctors know how to find the pulse and then write it down. And now how to find the temperatures. So you put your thermometer, okay?
Yes.
And you have your stethoscope. So these are the nursing step. If somebody don't know this, how will he become a doctor? He will not.
Yes.
So we need to encourage our people and let them understand the word nursing does not mean only to address wound. Wound can be addressed by anybody, any doctor. But the reason why it is fall under the category of the nurse is because job is divided in the hospital.
Yeah.
Even that patient, if the wound is not cleaned very well, the doctor will climb down all the way above and come and show him how to clean the wound. And he will hold the client.
Yes.
So that's why we need to start training certified nurses to doctors. That's why it's very important for a hospital to work as a unit, because a doctor cannot work without a nurse and certified nurse. He will be very tired and he will not do anything. So that's the importance of certified nurse assistant in the hospital. Let's go to other things. If you after you train your nurses and you dispatch them, what are the equipment you give them to perform the job?
Okay. Thank you. You see, the equipment can be tangible and intangible. What do I mean? I would like to start with the intangible equipment. The equipment may be the knowledge that we give to the people. Then it can also be the skill. You know, you cannot be a professional nurse or a midwife without having skill and knowledge, including the attitude of a professional nurse. So we will ensure that our students, the colleagues, either the graduate or the current student which are still under training, are adequately given a proper and competent skills, the knowledge and the attitude, because attitude play a role in healthcare. So if you don't have good attitude of how you can interact with the patient, how you can deliver services, health services to the patient according to the protocol of health, you are not a professional nurse or a midwife. So we will ensure that our nurses or a midwife have a good attitude that are favorable to the patients. The attitude may be ranging about how you communicate with the person, how you responded to the person in case if any challenge is asked by the patient or the client. So this could be the intangible equipments that we give. So the tangible equipment that we can give as a surgeon is that once, like for example, this project is now funded, like let me say the medical school get funded now, we can also write other important projects of requesting for other equipments to be brought. You see, and I was very happy when I was talking with my brother Majok, who is the Secretary General. So Majok encouraged us that in case if you achieve your project of having a specialized clinic, then we, the people of South Sudan who are here in the United States or in other Western nation, can be able to connect you with other people that can donate equipments like the beds, the mattresses, for example, the other equipments like lab equipments that can be used, uh, a other machine for scanning, for example, delivering scanning and imaging services to the people. So we will equip these people through this project because as a surgeon we cannot manage. Hello? Yes, yes. So we will use our project as another way of providing equipment to our colleagues that we may assign uh, to, 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 to any health facility in Bargadal or in ABA, for example. So we cannot be able to acquire some important equipment of the hospital or a clinic without first securing the project. So I would be very happy if the Almighty God help us succeeding the project of a clinic first. Then after that, the issue of equipment of the hospital cannot be much more challenging than securing the project itself. Because if we have secured the project and we have constructed the clinic, then things to do with the equipment in the hospital, anybody can help us. Even you, the Lake State media, can help us. And this is one of the assistance now that you are doing, hosting us to talk on the issues of healthcare so that other people which are very far can listen to our voice and then contribute to whatever they have in hand. Yeah. Could you raise your voice? I'm not hearing you.
I hear you now. Yes, you hear me, right?
Yes, I can hear
Yes.
you.
Yes.
Yes,
It's
yes.
a good idea that you are trying to bring it to the attention of the people of South Sudan so they can be aware of Banamsa. So also Banamsa also should understand before we build a very good hospital,
Yeah.
we can even function under the tree, right? A doctor will not wait to say, you know what, there is no hospital, so I can go home.
Huh?
So
Emoria. Sama lala. Kau want
yes, so the equipment, yes, tell us to wait because we are hearing her. So or you mute yourself. Mute yourself. So the equipment that I was thinking of after you train the nurses, they should have a thermometer, blood pressure, pulse oximeter, scissors, syringe for needles, uh, IDs, and some other equipment. But you said that we cannot afford this equipment, and that's why you are looking for the sponsors, which is understandable. And thank you for that. But we should not wait. We should be under the trees. Banamsa should be, the team that you train should go to rural and form themselves, sit under the trees, and we can help the patient. I just want to acknowledge to you what I did some years back, even if it is not really seen as a progress, but it's a progress. I was in Texas and I thought about building a school under the tree, and I did. Though I don't bring it in the social media, but if you go to my home village, there's a school called Wunto Primary School. My idea was just to find a giant tree and make some bench where people sit and plug the student in and teach them. And it's happened, Some students now are almost to sit for a South Sudan Certificate of Primary Education, and it's just under the tree. So we should not wait to say that I have to build a beautiful class or a beautiful clinic. We have to operate right away. Your idea of building Banamsa as an institution is very lovely. You and Deputy Master Wall, you're doing great job for creating awareness and training nurses and build school. We also should argue our government to sponsor such a very courageous and eye-opening institution so our people can learn. Master Wall, I will give you just a very short time to make some remarks, and then we will close the show once we wrap it up. Thank you. Go ahead.
Well, you are hearing me now, right?
Yes, you are very clear.
Okay. Well, once again, I want to appreciate you for another opportunity you have given me, Mr. President. About to you. So now, this all that my chairman have stated, these are actually our intention to why we form Banamsa, because we have seen the suffering of our people, and there is no way we can help them because Barghazal is very large and we are living in very different places. And we have to form a platform where we can meet together as one people and do something for our people. Yesterday, the meeting was conducted and was chaired by the president. And in that meeting, as he has stated, that we agreed, there were resolutions that were passed. And he assigned the secretary for health to run the process. we will work together very hard in order to ensure that all we have heard out today are implemented. We will engage both the government and NGOs in order to have all these things in place. In nursing, nurses need to be trained. They have to be updated every time. You know, when the nurse is taken for a workshop, he will have another new energy. There was an incident that happened yesterday in the hospital where I work. You know, a big man, a minister, but I will not mention his name. Yeah, a minister was having emergency on his health, and he was rushed to our hospital because it is in that hospital where the specialist on that particular part of his body was then. So when he was brought in, doctor could not do that work alone. He had to call the nurse, and I happened to be the person who went in with that to the VIP room to go and work on that man. You see, he's a specialist. He specialized in cardiology, the heart. You see, and that man had problem on his heart. We have to carry out an ECG. Yes, the patient.
Yeah.
Do you know?
We have to, you know, when we are operating in the hospital, there are professional language we have to adapt. We have to adapt the language of, because when
the client or the patient.
We have to adapt the language of client, the patients, because South Sudan now is still, when South Sudan become better later, there will be a policy a policy will be passed. For instance, how to you will be charged when you neglect client. You will be charged when you appropriately address the client. Stuff like that will happen later on when we come in. So we have to adapt the language of the patient or the client. Yeah, we have to say
hospital, the language of the hospital. Yes. So
come in.
Yes. So when the client came in, we had to go, two of us. We were three, but people were very busy. I had to go with him. You know, doctor only, he just observed the thing, but the person who do the work are nurses. We work on the client until we release him from the hospital.
Thank you.
I came to realize that it is only health that can humble any man. When you have health challenge, it is a great challenge. Do you understand? So absolutely. If there were no nurses in that hospital, I don't think how he would become by now. But this is what we want to extend to the other part of our community, so that we train more nurses. The more we have nurses, more nurses can do the work, you see, even without the doctor, you see. So so that is what I can say for now.
Thank you.
They need, even them, the people in the government, they need nurses, because we are needed. So
you know, it's very important now you identify the importance of nurses, which is a course that need, you know, when I talk about compact, it is even a 9-month course is compact into only 3 months, and those people can help. You know, so
they can help.
Yes, they can help because they are very educated. Do not underestimate their knowledge. So now you have realized the function and the importance of the nurse. Also, for now, since we are our hands is very tight, we need those training very quickly. We need very acknowledgeable professors very quickly to train nurses and then pour them into the field. And from there later on, you can do all those long bachelors and degrees and, you know, PhDs. But right now is the needy time whereby we need 3 months, 6 months, 9 months, 1 year, 2 years. You see that? So Banams actually should actually work on certified women, you know. Even somebody who don't speak English, you know, somebody who don't speak English can be certified through Monjang language.
Yeah,
She can,
absolutely.
yeah, she can, yes. For instance, how were we delivered? Myself, how was I delivered? How were you delivered? All of us, we were delivered traditionally. So are they not nurses now? Yes, they are.
They are nurses.
They are nurses. So the only, we need just to add some equipment, and we need to show them how to operate the beds. The one that, you know, when the woman wants to deliver, there is a one that can raise and lower, so the baby will be delivered wonderfully. So, but they are doctors. They are nurses. So we need to see those causes. So Banamsa have to work very hard to educate people how important a certified nurse is essential to our society of today. You know, and also yes. So when maybe if I come to Juba, we want to sit down so we can collect good number of nurses and put them in the class, train them.
Yes.
Yeah. It's very good. I love it. I love the topic. I love I love the topic of healthcare. You know, and I really appreciate you. It could be with healthcare system in Bar Al Ghazal. You know, because Bar Al Ghazal is below it to make UN. Bar Al Ghazal is below it to make neighboring country like Kenya, like Uganda. So road. So the only way is for us to work hard. You know, be taught, be well, be kayaga. Maybe alone nyali buku ripia kekriya bana bi pia, but barkazal jirala lo yiti chime kegiti wal bentin kegiti puj bentin, but it's not that far. Being eligible very soon. We kagwin we got ben we got you welcome Lake State Media. We got book be ben back be ben tani. We got book host back kichak bela at this short time back be very level. You know, we got book ya host Lake State Media is a platform for all South Sudanese who want to voice their concern. It is not only for Rumbe, Yerul, and Chebet. It is just a name. It is like now when you go to New York and you find what is called New York Times. New York Times is not only for New Yorkers. It is for the whole world. If you want to write your article, you go to New York Times and they will release it and the whole world will study it. So, other people, when they hear Lake State Media, they only say, oh, I don't want to come there because it is only for Lake State. No, it is just a name. But Lake State is a media that bring all news to you, whether you're from Equatoria, whether you're from Upper Nile, whether you're from Lake State, whether you're from Bar Al Ghazal, it doesn't matter to us. As long we are talking about something that will take us forward to change life and make South Sudan a better place for us to live on. So, and in Chaka Chagating and Ranechol Bol Makur, Yela Ranechol Madin Majak, Ranechol Isaac Tiangfol, Ranechol Majong Makur, Ranechol Agarmobok, one of the gentlemen, Jaloi, of which Ben one day, H.L. Peter Ken, our coach, Lake State Media. Anytime you shoot a message to one of us, right away will respond and will bring you. Healthcare is very important, more than even other things in South Sudan, because without healthcare, people will not be able to live. So thank you so much. Manuel, I am very proud of your knowledge. Mr. Wall, I am very proud of your narration and highlights to let the people of South Sudan understand what are you doing with Banamsa. You can even organize and stage a fundraising. People here outside are willing to help. You know, we have raised so much money in Lake State Media, and when other people come forward. But healthcare is very important. But only the problem is after money raised, there is a question. So in a problem,
Yes.
if you raise the money and the money go to the right project that can help, then people will give $2, $3. The people in USA, the people in Australia, the people in Europe are very generous, you know, are very generous. So though people try to think that these people in US don't help, but people in US help so much. We have remember when the economy of South Sudan collapsed, we ourselves are the one holding it up, because if problem come in South Sudan, it's fall on our neck. You know, even if I don't give somebody, but when I support my relative, that means I am supporting the government of South Sudan. It doesn't matter.
Yeah.
Minister in Yewu, it doesn't matter. Be a minister of education, but if I'm supporting an individual, it means that I'm supporting South Sudan. It means that he is in Australia is supporting South Sudan. It means that he in Europe, in London, is supporting South Sudan, and that's how we are. That's how we are. So I am very happy to host you today, and I will close the show. I will be waiting for you when you contact me next time, or I will let you know when I come to Juba. So thank you so much. God bless you. We will close Lake State Media. Our viewers, we thank you so much for joining us on our topics of health. And you are now listening. You are now listening to the voices of Banamsa. They need help. So next time when you hear them coming, these gentlemen, you will know right away, these are the gentlemen who established an institution there, training nurses and doctors, so they can deliver service in Bahr el Ghazal. I believe I'm clear from here. Thank you all. I will let you go, and God bless you, and it will develop. He will develop your mission to create more institution in our country. God bless you all. Thank you. I might give one word anyway to all of you for a closing, instead for me to close it. I give one minute to Balwal, give 1 minute to Wall, then I will close it.
Okay. Well, briefly, can you summarize?
I said you can give one closing.
Well,
go ahead. I said I'm giving each of you. I'm giving 1 minute, minute closing statement.
Yeah. Yes, we got it. We had it. Well,
yes.
You can proceed.
Yeah. All right. Okay. Yes, well, what I would like to say to the public now is that Banamsa or Barhazal Nurses and Midwife as Student Association, it is a platform for all of us, people of South Sudan in general, and the people of Barhazal in particular. So what we want is the responsibility, is a collective responsibility for each one of us. If you know the person we are looking for, or you know somebody who should help us, you just please, we are open. You can help us. You can take us to that person, cut all our hands and take us to the person. What we will say is our own. So what we want is just you help us, pave the way for us in order to meet the person we want to meet, and the rest we can continue with it. So help us. It is a collective work for Banamsa to succeed. or for all our projects to come to pass and be seen by the world is a collective responsibility, collective work. I need your help. You also need to help us. So that is what I can say now. But for this platform that the Lagos State Media has given us, I am very, very happy for being hosted. Thank you.
Thank you, Mr. Wall. Go ahead, Mr. Malwal. Give us one closing statement.
Okay. Finally, I would like to thank Lake State Media for taking role of hosting us today so that we can share our idea or our belief as a medical association in Barakatal. Lake State Media now become the second media outlet after SSBC, because SSBC was the first national media that broadcast our news during the swearing-in ceremony. So I thank all the members of Lake State Media for hosting us today, and we are delighted to be always with you in case if we want to share any information to the public. I would like to say two things to the government and to our people of Baragadal. You see, there is a problem. When we talk about the number of nurses in Baragadal is inadequate. From 1,550 nurses and midwives, the great number come from Equatoria. The question is, why are we lacking nurses and midwives when the Minister of Health herself is from Baragadal? The Undersecretary in the Ministry of Health is from Baragadal. The President, who is to divide the budget to any ministry, is from Baragadal. The first Vice President is from Equatoria, from Upper Nile, and also other important ministries are from Upper Nile. Now the question is, why Baragadal is facing challenges in healthcare system and also is having few number of nurses and midwives when we are the one leading the government? You see, I stated when we were doing inauguration that it is impossible for someone to suffer from hunger when you have a food in hand. It means that you are not serious. You are not a serious person. You have food in your hand and you are suffering. Either someone is seeing you suffering from hunger or you are complaining that I'm hungry. I need food when you hold food in your hand. You see, this is a big question here. We are the one leading the Ministry of Health, starting from the Minister of Health up to Undersecretary, and we don't have more number of nurses and midwives. Equatoria now is leading. And this ministry has not been led by the Equatoria, by the way. But how did Equatoria make? Yes, let me complete. You will come.
You will complete. I just want to answer your question. You said you said that you are very surprised how we have a president in Baral Ghazal, we have Minister of Health in Baral Ghazal, and so forth.
Yeah.
Have you ever, because I know you are very educated, have you ever heard that when you employ, there is a policy in unemployment said that you should not employ your brothers and your cousin in the same institution because one problem is there will be, there will be disregard of command.
Yeah.
Because these people are your relative, and when you want to command, they will not do the command.
Yeah.
So that's one thing. There will be in conflict of interest. That's number two. So now let's go back. When you employ the people in Baral Ghazal, whereby the president is from Baral Ghazal, then the Minister of Health is from Baral Ghazal, and what again, you said three things from Baral Ghazal. So
yeah, the Undersecretary in the Ministry of Health.
So the job will not be carried out because the commands are not going accordingly. Because if you want to command a cousin, if you want to command a brother, they will not do the job because they are brothers. And that's why job should be, job should not, the country job should not be given to, as you know, it is just like a nepotism, you know. So the job cannot be done very well. And for take this forward a little bit, if you can see all those minister of education, minister of whatever, they are from Bahr el Ghazal. But where in Bahr el Ghazal? Is it from Lake State? No. Is it from Rumbek? No. Is it from Chebet? No.
Wow, maybe.
Let's count it until all this one will fall under the category of maybe the people around the president, you know, and the job will not be done because there is no command. Can
I put something across here? Small for a moment. Yes, now what Mr. President is saying here is that these people actually they are holding key positions, and the people under them, they have money. So their money, I don't know what they do with their money, because if you see there is something weak, the weak part in your place, at least you can invest it towards that place. For example, you have money and you want to invest. Instead of going to outside to invest your money and bring income, why don't you just throw some part of that money you have and build an institution there? You build a healthcare facility there, and then let it be managed by those people. You tell them that this is just a gift to you people of this community. I give you this one from my own art. And also you can build a school. You can build clinics just for villagers. If 2 to 3 people, if they can do it like this one, at least they have done something. But now they have money, they have time, they have opportunity, but they are doing nothing with it. If they don't know what they want, what they can do with that money, at least let them give it to Banamsa. We will do exactly what should be done with money. Yeah. So we are not happy with the way they are handling money, because this is not the way they should handle money.
Thank you.
This is not the way
we should handle money. Have you heard about the statement of one of the? Have you heard about the statement made by one of the presidents saying that Africa is a janasa, is a mushri whereby people are buried? So our villages, people turn them into cemeteries, because I am in Juba.
Cemeteries,
Yeah, I am in Juba and I don't want to supply my village, and I had money, but when I die, I will be buried in my village, right? So
in the village, yes, absolutely.
Yeah. So now I said that president said that Africa become a cemetery, and now I take that statement and I said that our villages become cemeteries, because we only in Juba, we only in Juba, but we don't want to supply our villages so they can do things like you mentioned. Only, but when somebody is perished, he will be buried in the village, because there's no any other place. The Equatorian will say no, he cannot be buried here, because it is a communal what? Communal land.
A place of land of the community. The land of community.
Land of the community.
Yeah.
So it amulek bamti kudu.
Yes, bedefunu.
Betafanu binak 15. Guruj bitak de fadol wen. Guruj bitak de kaman fadol fi Juba. You know? So
ma Juba guruj bitam datu nas del maendum guruj ne fi Juba. Guruj bitam kulum gaidin bara. Ay zol balga guruj bamol hesab be bara. Ay yalla guruj da kanita dusu guruj da mana akwanak lamanita mutu baden. Akwanak ma biaro binta hel inta gurush wala inta ma inta gurush anu ma hasal yom wahid inta adetum fursa ashan yarb asrar batak and gurush maji. So when they see like this one, they will say this man died and there is no money, but money is in the bank, but it is somewhere from the other part of the world. You see, and they will not know it. Yeah.
Peter Paul already ate us. He said that the sad part that people spend the money
is they spend money in East Africa. Yeah, actually, yes, right? Yes. We have invested a lot in East Africa. You see, do you know why you? Yes, I come in now.
Go ahead.
Yeah, could I put something here?
Yes, go ahead.
Yeah.
Yes. Yes, let me comment on this very important issue. You see,
yeah,
when we are talking about Baragadal holding the power of South Sudan, we are not talking about Baragadal to be developed alone, leaving Upper Nile or Equatoria behind. What do we mean? I may use two ways. You know, in Dinga language, it is very clear in Dinga that you see?
Yeah.
That is very important. So I would have become very happy, or I would be very proud for a politician of Bargadal to develop our region, just like what the Equatorians are doing. You see?
Yeah.
Equatorians are the one developing their own region, either from
State,
healthcare or from the schools. They are the one who are focusing on the development of Equatoria alone. You see? Why can we adopt the same culture of Equatoria and do it in Bargadal? Like, for example, you, my brother, Bol, if you may have money in the United States or where you are staying from, so it would be very important for you to prioritize the problems, identify the most important problem, and then use your money to invest in it. Rather than, for example, funding wrestling activities, living education, or health. Because first of all, if you have good wrestlers, what do you get from there? Nothing. It's just all about promoting peace and unity to the people. But if you invest your money to healthcare by maybe donating number of beds or building a clinic in Chuaibet, you contribute importantly than someone who is funding wrestling. You see? And you will be recognized because what you will build in Chuaibet or in Gok Machar or in Mijak County in Nabia will remain there forever and you will be praised. That structure will remain there, that it was Bol who initiated it and who made this one to us. It will remain forever. You see, what we mean is that for our people to prioritize the problems. You know, in health system, there is what they call health equity. Health equity mean in simple explanation, like if you are suffering from cough, for example, and I'm suffering from malaria, so the services that will be given to me will be more than the services that you get, despite the fact that we are all patients, we are all suffering from the sicknesses. But your sickness will not enable you to be given more health care or services. Why? Because the sickness that I have may have difficult complications, things to do with the convulsion, things to do with anemia. You see, health equity should be very important and it should be done by the Minister of Health, identifying the regions. What are the regions that are facing poor healthcare system in South Sudan? The first region who is supposed to actually receive healthcare, good healthcare system, whether number of nurses or midwife or number of medical schools or number of health facilities is Upper Nile, because Upper Nile is doing badly down, followed by Baragazal. So it would have been very important for the Minister of Health to identify the regions that need urgent intervention of health care in South Sudan, and then prioritize it rather than giving equal opportunity for all the three regions to have services. Like if you go now to other part of Bargadal or other part of Upper Nile, you see someone can test the drug, and if that drug is either bitter or sour, that person identify that it is for malaria. You see that?
Yeah.
And why is this one happening? It is happening because there are no health care services that are supposed to be delivered there. No hospitals. Because you become familiar to something when you are exposed, when you have experience of it. So a person may test the drug and identify according to the test because there are no health services or healthcare centers. Like for example, if we talk about Awairal is totally down in Greater Lakes. You go to Chebet, it's also down. You go to Rumbengnos, they are doing badly. If you go to Abia, it's worse of all. This is a least performing state in Baragadal in terms of healthcare, because there are no more healthcare centers. There is no even medical school that is in Abia currently as we are talking. So students of Abia either come to Rumbek or to Awil or to Wa or to Kwajok or to Juba, where there are medical schools. So
Or to Juba.
I was talking on this point before that. Why are we suffering with the people of Bargadal when we are holding the power? Is for the ministers to sit down with their team and then identify the areas that need serious intervention. Areas like Abia,
Yes.
areas like Gogmachar, areas like, for example, Gogrial, West, areas like Awarial, like Chaibet, like Rumbegnos, another part of Baragadal, including Upper Nile. You see, that's why we bring this point. We were not trying to advocate for tribalism to be applied by the Minister of West to make sure that she deployed Baragadal alone, leaving other regions. No, this is not what we mean. We mean for her to sit down and prioritize Baragadal and Upper Nile to be the focusing areas of intervention in health. Because if you come alone to Central Equatoria has more than 10 medical schools that are already operating and they are graduating nurses and midwives every year. You see? Now, if Central Equatoria alone has more than 10, what about Eastern Equatoria and Western Equatoria? This tells us that the number of facilities or the number of medical schools that are, for example, in Central Equatoria are more than the number of medical schools that are in Barakatal. We don't even talk about Upper Nile. In Unity State, there is no medical school at all. Number of PHCCs or number of healthcare facilities are very few. If you go to Malacan, it's totally destroyed. You see, the one which is now quite functioning in terms of medical school is in Jonglei, and it is not to that capacity of recruiting more number of students to be trained each year. So we are calling on the government to prioritize the most affected or the most needy areas to be helped in terms of healthcare. This is it. Another call also to the same government of South Sudan is for the National Assembly uh, to pass a resolution of increasing the budget of healthcare or to the Ministry of Health. You see, increment can help the ministry to execute its role or its duties that are assigned to it by the law. You see, we are also calling on the same Parliament of South Sudan to pass the recent proposed salary structure, which was done by the former Undersecretary Dr. Mayan Mashud, to pass it, because you cannot expect me to work in the hospital where I get 3,000. What do I do with this 3,000? This 3,000 cannot be able even to buy for me, a floor, a sack of floor in South Sudan here. This 3,000 can be adequate only for a plate of food. Now, if I'm receiving 3,000 a month, and even this 3,000 per month or salary of my working station are not coming monthly, I can resign. And if I resign, who will work? Who will be in the hospital to deliver health services to the people? So we are also trying to advocate to the government to make sure that the increment of salaries of health personnel is immediately look into it and implement it. The good of it is that the proposed salary scale structure has already been made by the former and the secretary, and I don't know whether the parliament is now working on it or it has already been passed by the parliament. So this is also about the important thing that we will look like the government to look into it. We will also like to call the government to make sure that there is a scholarship offered. I'm hearing yesterday that the Ministry of Higher Education here in South Sudan received 300 scholarship from Egypt. So this 300 scholarship, suppose 100 should be made strictly to the nursing and midwifery education, so that you enroll 100 to be given to nursing and midwifery education, so that it can promote nursing and midwifery education. And also it will help other people which have completed their diploma here in South Sudan to go outside. Because if I have completed diploma in midwifery, I will be having no chance to get a school for me to go for bachelor, because there is no school that is offering midwifery degree in South Sudan. If it is there, it might be male health in WAP, and it is too expensive. A one semester is $1,000, which is 400 here, 400,000 pounds in our currency rate. So, someone, a poor person or a common citizen like me, cannot afford to study in Saint Mary, in WAP, or in Mary Health. But if the scholarship is now offered by the government, where nursing and midwifery education is prioritized, I can fill the form of scholarship and go outside. You see, we are also calling that. We also call on the community, particular people of Bargadal, to contribute to the development of their region. You see, this development of any country can rely on the government or the president or the deputy president or any person that is in the government. A development is the responsibility of everyone. You play your role, the government play your role. Just like what you are now doing as a legislative media. This is a developmental role that you are doing of providing information. The same should also be adopted by our people in Barakadat. Those who have money, if you identify that there is a challenge in your area, invest your money to address that challenge. You see, you also offer scholarship like what ABA is now doing. ABA is offering a small or little vacancies of scholarship here in Juba. I got some of the students that are sponsored by the ABA administrative area government. This is a good initiative. So the same issue should also be applied by Lake State, by Western Bahar Gadal, by Northern Bahar Gadal, and also by Waraf. They should also adopt the same system which ABA is doing of sponsoring students of nursing and midwifery faculties. So these are our calls that we need to make to each and everyone, whether you are from the government or you are from civil society or you are from a community group. You need to play a role in developing your community. And the major problem why we are still behind in this issue of having pure nurses and midwives or pure health facilities in Bargadal are three. One, it could be a problem of communal fighting, because you cannot expect me to study in Kwajok Health Sciences Institute when there is a fighting in Kwajok town, like for example, if I may use Kwajok to be the war zone. Or you cannot expect me to study in Rumbek Health Sciences Institute where there is a targeted fighting. You see? But the good part of it is that our state governments are now working closely to make sure that there is a stable Baragadal in terms of security. It is already done in Lake State, and we appreciate our governor for bringing peace. And it's also taking place in Warab, because these are the two areas where we are experiencing communal fightings. So the problem was the communal fighting, because you cannot expect a development to take place when there is a problem in that very area. Another problem why we have number of nurses and midwives, which are very few or few health facility, is the belief, like what I stated before. Our community believe that if you studying a nurse, if you're studying a course of nursing education, you are not someone who is important in medical field. This belief should be immediately fought off, and it should be wrapped away from the mind of our people that nursing or midwifery education is very important, and these are the important people. So the another challenge of us having few number of nurses and midwives is that we have that traditional belief that we need to talk of and that we need always to advocate of it. And then third one is that our people fail to identify the most important thing that they need to focus on or that they need to invest on. If you follow our politician or Baragadan, you hear someone is donating huge amount of money to a certain issue that is not important. You see, living education or living healthcare system in Baragadan. So these are the reasons. But if you come now to Equatoria, if you get any person from Equatoria is actually having this system of American where they say America first. So in Equatoria it is Equatoria first. To Equatorians it's Equatoria first. Because they are investing their resources to the development of Equatoria region. They also does not have this belief or where they say a nurse is about someone who make a wound dressing or a midwife is someone who is about delivering a woman. They don't have. So if you get any person from Equatoria and you talk about nursing and midwifery education, that person will stay with you until you tell properly. For example, if it is a matter of scholarship, you tell Equatorian that yes, there is a scholarship of nursing or midwifery education. That person will not leave you until you give the highlight or the insight or where the scholarship is. And that person will immediately come in and fill the application form. But if you come to our people from Bargadal or Equatoria of Upper Nile, it is actually challenging. They don't believe. So we need to address that. All of us, whether a medical station like Banamsa, whether a media like Lake State Media, we need to address this issue because South Sudan belongs to us and we are responsible for its development, despite the fact that government is supposed to lead a major role in developing the country. So these are what I can put across, and I thank Lake State Media one again, and lastly, and also our listeners, our viewers who are actually watching our program, and I would be very happy to get a continued support for Banana to be supported by everybody, Lake State Media, our people in diaspora, and our people also here inside South Sudan, as well as the government. So I thank you very much, my brother Bech, and also my brother Bol, I mean also the Secretary General who has just left immediately, and then the whole team of Lake State Media. Thank you very much.
Thank you, Malwal Ajun Bangrial.
Yeah.
Your hosting is very important because this is something concerning health. But you know that nowadays there are topics in Junub Sudan which become like preaching Bible.
Yes.
You know, when a priest is preaching Bible, a lot of people walk away. Yeah. So it's become like that. For instance, you are here today talking about health, which is very important. This podium would have been packed up full.
Yeah.
But very only 25 people who contribute themselves to listen to this very important message are here. And if it was politics, if it was now about oil, that oil is being drunk by a minister from China, it could have been packed. And if it would have been a politics about the position that coming up in Juba maybe or a revolution change rising, it would have been packed. But if it could have been about agriculture, which will put food into our mouth and on our table, nothing. That's what's going on. So some very valuable topics are not being attended, but some useless topics are being attended very well. Next time. We are also very appreciative to our audience, the people who are here with us watching about this program. We thank you so much. God bless you. we will close the show because another show is coming up. Professor Akec will be host later. So if you want to attend it, so be ready. Thank you all.
Okay, thank you very much.
Thank you very much, Malwa. Thank you.
Nice time.